Good afternoon. This is MedSurg Nursing. Brain disorders. This is part 3, tumors and infections. Now, brain tumors, there's typically two kinds, metastatic and benign. Right now, the etiology is unknown. Pathophysiology, pretty much it's the own brain tissue growing and causing havoc by pushing against the brain and occupying space. Signs and symptoms could be headaches, and depending on where the tumor is, dysfunction of that part of the body. Diagnosis, we could be doing CT scans, MRIs, and treatments, typically surgery, removing the tumor. Radiation therapy could be just like a pointed radiation to that area, and chemotherapy, in which they need to have like a reservoir, because chemotherapy will not cross the blood-brain barrier, so they have to put in a reservoir and then put the chemotherapy in there accordingly. Nursing management of tumors, once again, we need to do routine neuro assessments. That includes your glaucoma scale and stuff, including activities of daily living, pain assessment, and control. Complications, typically hydrocephalus was a big one, because as the tumor grows, it can impinge on circulation of the cerebrospinal fluid, blocking it off and then causing swelling of the brain. And we can cause intracranial hemorrhage. Maybe the tumor is getting into the blood vessel area and then can cause bleeding that way. Next is meningitis. First, we're going to look at bacterial, and then we'll look at viral. So bacterial and meningitis, once again, is inflammation of the covering of the brain, the meninges. Typically, you have an increased intracranial pressure from white blood cells, bacteria, and debris that block the circulation of cerebrospinal fluid. Signs and symptoms often are sudden onset of a fever, severe persistent headache. That's greatly aggravated because you're moving your head around. Diagnosis, we are going to do a spinal tap, which they're going to get a cerebrospinal fluid sampling, and this is where they're going to find white blood cells and bacteria in that fluid. Treatment typically is IV antibiotics, usually 2 of them, and this is going to be started immediately, because once again, this can lead into disability, long-term disability, which is bad. This picture here shows you the different layers of the meninges. Once again, there is dura mater, arachnoid, and the pia mater. The dura is at the top, which is like the dura. It's very durable, and the pia is very delicate. You have underneath the dura, actually underneath the pia is where you have blood vessels and stuff. So we can have bleeds that way. Assessment, once again, for meningitis. A positive Brzezinski sign is a passive flexion of the head and neck, causing flexion of the thighs and the legs. Once again, don't forget, because it is inflammation of the meninges, those meninges not only cover the brain, but they also cover the spinal cord. So that all of that is going to be inflamed as well. A positive Koenig sign is inability to extend the legs from a position of 90-degree flexion at the hip because the pain and spasms of the hamstring muscle. Once again, it's usually because of the irritation from the meninges. Viral meningitis, usually milder than bacterial, usually is caused. Signs and symptoms, you're going to have a headache, fever, photophobia, and a stiff neck. Once again, photophobia, meaning you are going to be sensitive to light, any type of light. A lot of times, involvement of the brain is not common. Diagnosis, we're going to do a spinal tap, where we're going to be sampling the cerebrospinal fluid, and you will find a CBC showing increase of lymphocytes or white blood cells. So something's going on. Prognosis is usually self-limiting. It self-resolves. Full recovery, usually 7 to 10 days. and may have some residual effects, maybe persistent headaches, mild mental impairment, or lack of coordination. So once again, they're not totally out of the woods, and it needs to be taken care of. Additional assessments that we need to look at is neuro checks for increase in cranial pressure on both of those. Stiff neck or paralysis. Watch the temperature, monitor the temperature trends, assess their fluid electrolyte imbalance, skin, mucous membranes, and INO. Check out their GI system, bowel movements, distension, constipation, nausea, vomiting. Once again, nausea and vomiting could be a result of increasing intracranial pressure. Intravenous access, you should typically have two, one's for antibiotics, one's for other fluids and stuff. Monitor the skin condition and the psychosocial concerns as well, because the person is probably scared that they may have permanent damage from here on out. Encephalitis is the other one. Typically, this is coming from ticks and mosquitoes, especially the West Nile virus or the herpes simplex 1 is a common cause. Other things could cause it, like chickenpox, measles, and mumps, especially if they did not get vaccinated as a child. This one here crosses the blood-brain barrier, which disrupts normal neuron function. You can have bleeding in the brain, inflammatory response occurs, the gray matter. Once again, all that is leading to, you said it, intracranial pressure increase, which can cause more problems, more issues, more function, more disability issues. Signs and symptoms, once again, could be sudden or insidious, meaning slow and you can't quite figure it out. Behavior and personality changes can occur, decreased level of consciousness, stiff neck, photophobia, and lethargy. Once again, changes in level of consciousness, and especially stiff neck is classic signs. They may have seizures and acute confusion, flaccid paralysis. Once again, this is all about the brain. It is impacting the gray matter. CNS signs usually appear 1 to 4 hours after the onset. Lethargy may progress to a coma if nothing is done. And then if the patient is with herpes simplex, may exhibit like flu-like symptoms, because that is more like a virus. Diagnosis and treatment and complications. Diagnosis, once again, virus in the cerebral spinal fluid or the blood. So they're going to do blood draw and a spinal tap. If it's caused by some herpes simplex, we're going to look at the cerebral spinal fluid. You're going to have a slightly elevated white blood cell count, maybe a little bit of a protein, but your glucose is going to be normal. Typically, in a bacterial kind of things, it's probably going to be a high glucose levels. Treatment is typically symptomatic, but support measures, once again, supporting the airway, supporting the oxygenation, and supporting the cardiac, meaning the heart and blood pressure. Maintaining the patient's strength, promoting healing, and preventing complication is our job as nurses. Complications, so we could have neuro disabilities, problems walking, paralysis, cognitive issues, memory and self-care issues if this is not treated appropriately and promptly. Last and not least is brain abscess. Once again, this could be caused from improper dental care, because this infection comes from the gums and the teeth. It could be from sinuses. It could be ear infections or the mastoid region that all go right up into the brain and cause an abscess. It could be from head injury, especially like it's more like an open head injury, or cranial surgery, which there was infection involved. Signs and symptoms, we're looking at a headache, fever, and progression to lethargy and confusion. Once again, all that is leading to changes of level of consciousness, which actually is a result from, you guessed it, increased intracranial pressure. So if you haven't figured it out yet, all roads lead to ICP increase. Patient teaching, we need to be treating the sinus infection, especially if it's been longer than a few days. Do a combination of antibiotics to eradicate the abscess, and surgery to drain the abscess to relieve the intracranial pressure. If we do not relieve the ICP, they're going to have detrimental effects. It's just going to keep on rising. It could shut off parts of the brain and actually kill them. And that concludes this slide.